I am really happy to see you all through the webinar. This initiative, actually, I want to thank Dr. Warid. He is the person, this is his brainchild, to conduct the program through the webinar since you all are on leave. We didn't want to disturb you all, but anyhow, to get utilize the time maximum, we would like to call you for this webinar on discussing of the disaster management during this man-made disaster conditions in the country. You all know the situation. Like other sectors, we also suffer in many aspects of running our healthcare institutions and the MOHs all over the islands. Likewise, dental sector also is affected. Yeah. So what we thought to get an expert on these issues, though he is an engineer, he would. I hope that he can understand the situation of the hospitals and the management crisis what we face at the moment. The shortage of medicines and shortage of medical equipment, consumables, surgical items, and the demand of the patients is rising all over the island, and the monetary issues. They now patients looking forward to the government sector rather than going to the private. So we have to be prepared to face the situation. What we expect, sometime the situation may go worse, but we pray it shouldn't be like that. But anyhow, this webinar would address the current issues, the country situation, what we are facing, and impending disaster situations what we may face in the future. So I would like to welcome you all, the participants, especially Dr. Sukunan. He took time to be with us, and thank you very much, Dr. Sukunan, and all the other participants. And especially I would like to thank Mr. Saja, Ms. Saja, to be a resource person today and to give his valuable time to be with us on this occasion. And I thank you again, and I welcome you all. So since we are running out of the time, I would like not to extend my speech at the beginning, and I welcome all again. Thank you very much.
Thank you very much, sir, for your kind welcome speech. And now, without further delay, we are moving to the webinar. For that, I just want to have a brief introduction of our today's guest speaker. Today's guest speaker is Dr. Saja, has more than 7 years of professional experience working with non-government organizations since 2004. He worked in RDHS UK in Sri Lanka and the European Commission Sri Lanka and Maldives office, where he managed or monitored a number of projects in pre- and post-disaster phases. He has trained many professionals and local practitioners in the cross-section of emergency in 2013, and continues to research and publish in high-impact Q1 journals in the areas of resilience, risk, and sustainability science. He is currently a global fellow at Brown University, United Kingdom, USA, a young scientist, international research and disaster risk, and community solutions fellow in international research and exchanges board, and also Department of State, America, USA, and he completed Bachelor of Science Engineer and Master of Science in Engineer degrees at the University of Peradeniya, and holds PhD from Queensland University of Technology, Australia. Without further delay, I would like to invite Dr. Saja to deliver his speech. We are welcome you.
Right. Thank you, Dr. Wazil, for that introduction, and also thank you for giving me this opportunity. The RDHS, Dr. Rifas, and all the other doctors and the members. So without further delay, I will just quickly go into the presentation. What I will do today is about the general crisis management. I will give you a framework of what crisis management includes. And then I will also touch on some of the health aspects. So I started working in disasters after 2004 tsunami. And then I also worked in the humanitarian response in the north during the war and after the war with European Commission and other NGOs. So I will base my presentation based on those two experiences, and then I would like to have at the end as a discussion. So I will not take much time on explaining things because you are all experts, but just to keep everyone, there may be young doctors as well. There are experienced doctors as well. So I will just try to give you a very, start with the very basics. Right. So what I will cover, the key terms in crisis or disaster management. So by the way, my PhD is also in disaster resilience. So that's how I got into this field. Then I'll just give you a brief framework of how the crisis management is handled. And then a brief overview of healthcare in a crisis situation. And I will give you a brief introduction to the sphere. Sphere is the global standards for humanitarian response. And then finally, the resilience. Resilience is the key aspect in managing crisis situations and disaster or emergency situations. So just to give you an basic overview of what is crisis, what is emergency, and what is disaster. So crisis is where there is a time of difficulty or danger, potential danger, which may become an emergency. So like what you have now in the country is kind of an economic or social crisis. And then if this crisis gets serious and unexpected or often more dangerous situation may arise. So that time you may need to go for emergency. Video. I hope you can see my face, right? My video is clear. I hope you can hear me as well, clearly. Anybody can confirm, please, the participants?
Yes, we can see you and the slide.
Right. Okay. Thank you, sir. Right. I'll go ahead. Dr. Basil, I think it's from you, and there may be some issues. But anyway, I'll just go ahead. So finally, if the emergency is not managed well, then it becomes a disaster. So these are the basic terminology that you may be familiar with. And These are some other technical terms that we use. There is a risk, there's a crisis, there's an emergency, and if you're not prepared well, it becomes a disaster, and people who are affected by disaster becomes victims, and they are displaced sometimes internally within the country or outside the country, they become refugees. And these are different phases of a disaster. There is a preparedness phase and the response phase. So before a disaster occurs, we have prevention of potential disaster, or we can mitigate the impact of disasters, or we can be prepared for facing that disaster. And then we also have a response side where we need to do relief, immediate relief. And then once time goes, we have to rehabilitate and then reconstruct. And then finally, we need to develop the damages impacted by the disaster. So this is the common disaster management side. So with this basic understanding, I will now quickly move to the crisis management framework. So there are 9 key blocks in a crisis management. And you can think as health professionals, you can think of these 9 blocks in your organization or in your RDHS or in your MOH or in your hospital. These 9 blocks are very important to handle any crisis. For example, the first block is risk management. So the risk management means you need to first identify all the risks, and then you need to plan to prevent or mitigate or prepare and respond to those potential risks turning into a disaster. So we use a risk analysis template. I'm sure some of you may have done it already during the COVID period. So this risk analysis is important to plan anything that is getting worse and becoming a disaster. So all possible scenarios you have to identify, and then what is the likelihood of that occurrence, and then what is the potential impact to the people or to your institution, and impact rating, and finally risk rating. This is the scientific way of doing risk analysis. So it could be the risk in current situation, it could be long power cuts or electricity interruptions, food shortage, or no fuel supply, and shortage of essential medical supplies. So all these can be potential scenarios or risks. And then we have to come up with the risk ratings, and then we have to plan accordingly. The second part is planning. Based on the risk analysis, we need to do a planning. So this planning will have 2 components. One is crisis preparedness plan, the emergency response plan. So before an emergency occurs, there is a crisis. So we need to prepare to that crisis, and then we need to avoid that crisis becoming an emergency. So we need to do a plan for crisis preparedness. And then sometimes when we plan, emergency happens. So we need to be also ready to respond to that emergency. So these are the 2 key components in the crisis management, where we need to prepare for a crisis not becoming an emergency, but sometimes it becomes an emergency because it's sometimes beyond our control. So then we need to plan it for that, to respond to that emergency. Right. Then institutional framework is very key for any government or any non-governmental organizations or any institution, even a community institution or community organizations. The institutional framework is key to respond to a disaster in a professional way. For example, for health institutions, we need to continue the operation of all the health institutions, because health is one of the key important sectors in disaster management. So this continuity plan, it's called organizational continuity plan, is very important. And working with other sectors is also important. For example, the power sector, water sector, and other critical infrastructure sectors are very important in a crisis situation. So institutional framework is the important part. Then information systems. So we need to manage information, because information is the key for all decision making. As you know, we have a lot of experience. You have a lot of experience, I'm sure, during the COVID crisis pandemic. So the information is key. Always during the disaster time, information is problematic. There is so much information, also little information. So it's very difficult to find out the reliable information. So we need to have a common joint operations with other sectors who have information. We need to do some common analysis, and also we need to share the information, and also we need to distribute all those information to the public and to the people who are affected by disasters. And then resource base is another key important block in crisis management. This is very much important in the current crisis, because the stockpiling of the key things to run a health facility. It's about fuel, it's about medicines, it could be anything that is very critical. Because at the end of the day, our aim is to avoid or prevent any deaths due to a crisis, or at least we need to minimize the number of deaths. Then funding is also key. It could be funding for disaster preparedness, or it could be funding for disaster response or relief. And also we need to have a good coordination for those resource distribution and sharing. The sixth block is warning systems, which is very much needed for natural disasters like earthquakes or tsunamis. But also during this time as well, there could be a health emergency in the times to come. So that should be communicated to all the people. It's called last mile communication. It should go to all the people. And nowadays communication is very quick and fast through social media. Then the seventh block is response mechanism. So sometimes we plan, we prepare, but things happen. So when disasters happen, we also need to respond to it. So we need to also be prepared to respond. So we need to have a human resource for responding. We need to have all the facilities and stocks and transportation. And then we need to plan the response. So that will include ensuring further security of the affected people, emergency assessment teams, activating special installations such as emergency hospital facilities, activating community support systems, preparing emergency reception centers, and activating emergency transport facilities. So this includes an important part also in the crisis management when things get worse. Then public education and training is the eighth block, and the last block is the rehearsal. So the education is an important part. Education of public, not only public, but also your workforce is also important. Training the community leaders to manage the situation, because the not only health or other critical facilities cannot handle the crisis alone. So we need the support of the community. Public information awareness for the people, and also special education, maybe through school programs. And then finally is about rehearsal and mock drills. This is also an important part in the crisis management framework, particularly for the institutions, because anything can happen, such as fire, because now, people start stocking the petrol in houses or in other places. If it is not properly stored, there may be also dangers due to those situations. So we need to know about how to extinguish fire and all those things, but also some other drills are needed. So establishing community groups, conducting simulations, and also SOPs. I'm sure you have the SOPs in your institutions. So SOPs, activating those SOPs, and people and the workforce should be familiar with those SOPs. So these are the 9 key blocks in a crisis management. So you can now think of all these 9 blocks in your institution, in your health facility, in your hospitals, in your MOHs, in your RDHS, whether you have all these at least to some extent, so that we can handle a crisis. Right. So with that, I will just quickly go into the, I don't know about the time. It's a small video. I will come to that later. Healthcare in a crisis situation. I'm not sure whether you have any one of you have heard about this sphere. The sphere is the global standards that are used in emergency situation. I'm sure you must be familiar with the WHO guidelines. So this sphere is also taken for the health sector. It's mostly taken from WHO guidelines as well, but it's a collaboration of more than 200, 300 organizations who are working in emergencies globally. It includes international organizations, UN agencies, and all different institutions working in disaster and emergency situations. I just quickly go through some. There are few chapters in Sphere. This is a very useful book. This is available online. I can give you the link if you want to. The latest version is 2018 version. We have worked in the past in 2004 and 2011 versions during tsunami and during the during other flood and other crises. So this is led by International Red Cross and Red Cross Movement and Rifas, who is handling the disaster management in most of the countries. But that is a lead organization, but it is a collaborative organization with UN and other agencies. If you go to cluster meetings in Colombo, they will be, if there is an emergency, they will be sometimes talking about Sphere. Right. So I will not go into detail. It's a 5 days training. Sphere is a very long training, but I will just show you what it has. And there are 4 key factors included in the Sphere that are very important for any crisis. One is water supply, sanitation and hygiene, wash, food security and nutrition, shelter and settlement, and health. So as you know, all these 4 are very critical in a disaster situation. And so that is included. So I'll just quickly go through what may be relevant for this current crisis, then we can have a discussion, because you may have some experience in the past, and then that maybe we can take it forward for the current crisis that may get worse in the coming months. So the first thing, when you apply any action during a disaster situation, we need to think about who are the people that will be affected most. So vulnerabilities, and who has the capacity to address those crises. So not all people have equal vulnerability. The different people are affected differently, and every disaster, every crisis is different. So I'm sure senior experienced professionals here, doctors here, you have gone through so many disasters in the past. So your experience, I'm sure you have the same experience. Every crisis is different. So we need to plan it for every crisis differently. Right. So I'll just skip this because of the time. But if you want, we can come back again. Data collection and disaggregation is also important. We need to see, that's why I said we need to look at who is most affected. Disaggregated data is important so that you can plan better. So that it may include this. You may be focusing on children. You may need to focus on older people, elders, people with different gender roles, women-head households, pregnant women, lactating mothers, or different people at risk of gender-based violence, prevention of sexual exploitation and abuse, which is common during disasters, person with disabilities or person with specific needs, and people also need psychosocial support, and also people with non-communicable diseases that may be also possible. But we need to discuss this and see who will be the most vulnerable to the current crisis. So every crisis is different. So we need to think who will be the most vulnerable to different. I will have a discussion at the end based on these 3 aspects. So then you can have your ideas as well. So I'm just kind of trying to give some key points. Children, as you know, always in a difficult situation during disasters. Elder people need special attention. People with gender roles also need, women and girls, young girls sometimes need specific attention due to the different nature of the crisis. And people at risk of gender-based violence also have some bad impacts due to crisis. And prevention of sexual exploitation and abuse also is important. Person with disabilities need more support. People need psychosocial. People need psychosocial support. For example, now crisis may have exerted more trauma. So their mental conditions, psychosocial conditions may have deteriorated, so that they also need some support. And also maybe in this current situation, shortage of full medical supplies or medical medicines may also have some implication for people with non-communicable diseases. I'm not sure, I just read something about chronic kidney diseases. There are some issues. So it could be, you may have a better idea. Right, so I will quickly go through what is there in the sphere, and that can give you a good guide for you to prepare for the current crisis. So in any crisis, the aim of healthcare is to reduce the excess morbidity and mortality, right? So we know mortality is about reducing the deaths, and morbidity is about reducing the number of people with diseases. So it could be the direct impact, or it could be an indirect impact, right? So the morbidity rate should be reduced. We need to, that's the main job of the healthcare system, to save lives, zero morbidity, mortality, and also reduce the rate of diseases, the frequency, the morbidity rate. I'm not going to the details. There is a guideline to calculate the crude mortality rates to see the threshold of an emergency, whether it is getting worse or not. This is just a guideline. We should not stick to this. But what they say is the crude mortality rate should be less than 1 per 10,000 people per day. Over, you have to see how it is progressing. So these are some of the guidelines that are helpful. Also, maybe in the future, to declare there's a health emergency. If there's a health emergency, we can use these threshold. But this is not the only calculation that we need to do. We need to see how it can. But this is just a guideline that is given in the SPA guideline. And also under 5 crude mortality rate, the children. Right, so there are some calculations I will not go into it. Right, this is the most important part. And in the sphere guidelines, which is a global guideline, as I said, health is one important sector, and health systems is one of the key part in that. And there is an essential healthcare, which may not be applicable to the current crisis, but there may be some guidance as well if there is some related, some are related. So in the health systems, there are 5 key standards given in the sphere guidelines. So these 5 standards are very helpful for health professionals managing the crisis. First standard is about health service delivery. Second is about health workforce. Third is essential medicines and medical devices. Fourth is health financing. Fifth is health information. So these 5, if you can plan around all these 5, there are many. I'm just saying in terms of health system, and that may be more applicable to the current situation, is these 5. You can go through this. I will show you I can share the link for this sphere. Then you can go through in detail. There are so many guidelines that are guidance notes given to you to help to prepare the crisis. So first is about delivering quality health services. Second is trained and motivated healthcare workforce. Third is appropriate supply management, use of medicines and diagnostics materials and technology. Fourth is the financing, and the fifth is about health information. Right. So these 5 standards have a lot of guidelines on how to implement these 5 guidelines. So with this limited time, I will not go into detail, but I think if you just read this, you will, if you read the health system standards and guidelines in the sphere, you will be able to easily understand, since you are from that sector. And there is one more standard in second 2.1, which is called essential health services. That may be also applicable to the current situation. So you may need to refer to that as well, because that will have some aspects on prioritizing the health services, because during emergencies and crises, we can't do all the things. We need to prioritize. So identifying the potential health-related problems, identifying the most vulnerable people, prioritizing the health services and identifying the barriers, and also implement the priority health services in coordination with other sectors. So these are some of the guidelines that are given in that, and you have experience also, I'm sure, during the COVID-19 response implementing this. Right, so I'll just finish my talk with this, and then we can go for discussion based on the crisis management framework and the sphere guidelines on healthcare. Finally, about community resilience, we have Sri Lanka is prone to many disasters, and particularly the region like Eastern Province is prone to almost all the disasters except the earthquake and landslides. We are prone to floods, droughts, cyclones, tsunami as natural hazard disasters. And also we have heat waves, we have sea erosion, forest fire, air pollution, human-elephant conflict, traffic accidents, industrial accidents, chronic kidney diseases that may not be here, but other chronic diseases or non-communicable diseases, epidemics or pandemic. The list is long. We are vulnerable to all the crises, and current crisis about a socio-economic crisis that may also trigger some other crisis. This is just a list of disasters that happened in this area in the past. So I just got it from one of the history books. So cyclone, flood, tsunami, and pandemics, famine, COVID-19, pandemic, 1917, Spanish influenza. Likewise, there are, so the community in our region have gone through different disasters during different time. And the civil war also people have gone through. So there is a bit of resilience built in the community. So when there is a new crisis like what we face now, there may be already some resilience built in. So we need to see what additional things that we need to do to overcome the current crisis. Right. So final slide. These are the key messages from my talk today. One is about crisis management framework. It has 9 key blocks that every institution needs to think about. And then we need to think about the special attention in times of crisis. Who are the most important vulnerable groups that we need to address? And different institutions may have different groups. So health institutions may have a different, we may have some special attention groups. And finally, the 5 aspects of managing the health systems in a crisis situation: the health service delivery, health workforce, essential medicines and medical services, devices, health financing, and health information. So these are the 3 things that if you want to discuss further, and if you want to add more to this, you can use these 3 aspects for our further discussion. Right. So yeah, so I think I forgot this slide. There's one slide. Is our health system resilient to the current crisis? So for example, we need to think about the long power cuts that may come, or electricity interruptions, the time schedules, fuel shortage or fuel supply, or shortage of essential medical supply. So every institution needs to think about how long your health institution can survive with the available resources or with the stocks, whether it's in hours, days, and weeks in terms of saving lives. And how long it will take your health institution to recover if it is affected, because that is also important. If it is affected, we need to recover very quickly. That is also a resilient aspect. So how many days it will take, how many weeks it will take for you to recover very quickly. If the systems need some alternatives or different innovative ideas, what are those alternatives? What are those new resources required? For example, for power cuts, can we think of an emergency mobile hospital or whatever it is that is solar powered? I'm just thinking that was could be a solution. So you may have a lot of solutions. I'm just thinking, I'm just giving you some framework to think. Or what are the new alternatives to recover if that is if something happened, the crisis become an emergency, and you are affected, your health institution is affected, and you need to recover very quickly. So what are the alternatives that you have to come up to bring back the system running? So what are the new resources required? So these are the things that are needed to be thought in any situation. So finally, again, I conclude my presentation. I know it's very quick and fast. Sometimes we do this in 2 days training, 3 days training, but forgive me, because apologize me also as well because of the time limitation. I don't want to take a lot of time because we are already late. Try to finish on time. So coordination, collaboration, complementarity, and community service are very important in any of the crisis. So it's now time for you to reflect, and also if you have any questions, if I know the answers, I can also share my experience, or we can have a discussion. And thank you everyone for your time, and I'll hand over to Dr. Wazi for taking the discussion.
Video. Thank you very
Hello.
much. Yes, thank you very much, Dr. Saja, for the elaborative presentation. And actually, it was very useful to us. And actually, this, you already mentioned in abstract, when a crisis is not managed properly, and it's lead to emergence. Emergence not properly managed, and it's a catastrophe. So as things goes, so as today's present crisis in Sri Lanka, and as you mentioned, the socio-economic crisis, so it's heavily already now getting impacted in health sector. So it's a heavy impact. So the health sectors from the ministry, they are dealing very closely and deeply how to rectify this issue, how to overcome this issue. For that, now the floor is open for the discussion. I think our RDHS, Dr. Rifas also here, and also former RDHS, Dr. Sukunan also here. Now he's RDHS of Batticaloa district. And also we have Dr. Mahir. I'm now planning also here the senior doctor, Dr. Fazal, he's a regional epidemiologist, and also a lot of administratives are here. So now the floor is open for the discussion. We can have some useful discussion. Now,
Thank you very much, Dr. Saja, for your excellent presentation, and it's a timely need for the situation. Actually, when you consider the current situation of the country, as you said, is a crisis now. So to manage the crisis as the administrators of health sector in this region, what we understand, the supplies, medical supplies, and salary payments of the staff, and the accessibility and availability of all the resources in all the institution is the main issue. But as far as we know, this the salary and other issues will be maintained as it is in the system. But supplies of medicines and other stocks is now curtailed. So what we thought, as Kalmunai region, as far as we have taken all the stocks in the region, we thought that we are a bit well off than the other region. Now the optimum usage of the resources and critical analysis of all the resources what is available onto the region, and the usage of the resources as a region is very important. Since I took over this the position, we have initiated the mechanism called resource mapping. Resource mapping, that is, we have started this resource mapping under the motto of everyone for everyone. So we are managing to expose all the available resources in all the institutions in a transparent manner, and we are ready to move all the resources according to the need. Especially for the drugs and medicinal issue, we also run out of some important item in some bigger hospitals. Anyhow, the Ministry of Health and the Medical Supply Division is trying to support all the institution what they have in their stocks, and they try to purchase and make all the essential and important medicine available in all the hospitals. Likewise, now the patients and the public also now move towards the government hospitals since there is a financial crisis in the country. We also encourage people to come because we have I suppose what I understood through going through all the materials in front of me. We have some sufficient stocks to run the institution without any trouble for the next 2-3 months. But anyhow, we don't know how the situation would turn over in the future. But we pray it's not going to the disaster. But this is important for our institutional heads, since there are, though there are many dental doctors here, but it's very important for the other institutional heads also to get this point into their mind and understand the current situation and manage accordingly, because we cannot waste our resources since we don't think that this situation will not be settled as this the crisis or this the government change will happen, but that this is a existing crisis will may go for another few months or more than that. That is what I am thinking of to manage all the resources in optimum way, basically, especially on the medicines and the supplies. Even so, what we thought our well trained staff and other coordinating sectors are doing well with us. But the stocks what we have in our hands may be sufficient for another 1 or 2 months. But anyhow, we have to plan it accordingly, because it's an impending disaster. Actually, what I said at the beginning, it's an impending disaster, so we have to manage it accordingly. I think the webinar has to be repeated another 1 or 2 days later with all the other stakeholders, other hospital directors and the medical superintendent and the DMOs with their MOHs, to make them understand and plan according to their institution itself and the region at large. So thank you very much again, and the forum is open for the other participants to discuss, and they also can come out with their points. Thank you very much.
Thank you very much, sir. And yes, other participants, you can make your comments and reviews, and your reviews on this webinar. Actually, this is initiation. So actually, we need this kind of situation. We need experts' opinion. So, and I want to thank our guest speaker. So it was a short notice. The short notice, he accepted our kind invitation, and also without any delay, he made his presentation, and I was very much thankful to him. And also, as our RDHS mentioned, we need to continue this kind of webinars to all the health sectors in our region. So today, as it's a public holiday, and also we try to manage to include all the doctors due to some practical issues. It was very difficult. So we are trying to make another webinar on this regard to aware about this crisis management in health sector. So now the fuel crisis is almost there. Now we are planning for doctors who want to travel to a health institution. There's issue. There are electricity issues now is coming up. So as RDHS has mentioned, now we are making some alternatives for fuel arrangements and everything we are making. But anyhow, we need experts' opinion. So if the things continue, and that will be disaster. So in here, we need the experts and health sector want to work collaboratively. So I think this is a good initiation for this, and hope we will continue collaborative service for the community, benefit this community. And I'd like to have any other comments, please, our participants. Even though the participant is limited, but it's the first webinar is eye-opening to us. And now today, I want to welcome our former RDHS, Dr. Sukunan sir, and now he's RDHS of Batticaloa district is here. And sir, now the floor is open for the discussion.
Thank you, Dr. Varid, for this arranging such a very good initiative. So in my level of this sort of addressing this issue, so mainly we think of though we generally adapt to the formula how we can deal with this sort of issues, disaster management. Mainly we have to consider about the risk communication first. So that risk communication, we found three groups. One is the communication in between the Ministry of Health and us. Another one is intersectoral cooperation within our district and within our department, within our district. So there are three groups identified. So already we had a first line of discussion with all three groups. And mainly we are worrying about medicines, reagents of laboratory items, and fuel stocks, keeping some fuel stocks and uninterrupted power supply to the base hospital. And other thing is staff transport in future if something happens. And for this medicinals, we wanted to limit some area and we wanted to keep a power stock for emergency. And we wanted to switch to the Ayurvedic use of Ayurvedic system also for minor diseases because it is underutilized and we will think of utilizing Ayurvedic sector. For the laboratory reagent shortage, we wanted to limit the test in the OPDs and some routine test will be limited. And other way of the alternative way of doing the laboratory test instead of using a hi-fi machines, using a manual test by using the microscope or the basic calorimetry will be utilized for the laboratory test. So we will use both, and that's it for the time being. But our main concern, whether we are uncertain of the things in the future. So the IMF also, the possibilities of the loan from the IMF also, they are now questioning. So will it happen also, whether we wanted to switch to this disaster management plan right now, or we will wait for some time? And so when we have to start this, get into the disaster management plan is a big question to me. But anyway, we in some area, we have already started to limit the things. But when you limit the things or convert to alternative ways, the quality definitely will fall down. So that's a concern. But we are in sort of first line of management. According to the future developments, we will think of taking decisions time to time. So thank you very much.
Thank you very much, sir, for your opinions on this regard. And Dr. Saja, and as Dr. Sukunan sir mentioned, is it the time of that initiation of a disaster management plan? Is this the correct time, or your opinion?
Well, I mean, that's why I said in the risk analysis, the first step, you need to have different scenarios, and then have the alternatives planned for different scenarios. So, as Dr. Sukunan mentioned, you may think of 2 to 3 scenarios. So, if things go well, and if there is medicine import coming in, then you can replenish your stocks, or you can plan another scenario. If things get worse in a short time, what are you going to do, and how you are going to prioritize your actions, and also in the medium term, like 2 to 3 weeks, because there are reports coming in. These things will get worse in June, particularly on the electricity side. So we need to have different scenarios. Nobody knows how it will go. So activating the plan will happen at that time. So you will have around 2 to 3 days of buffer time to make a decision if things go worse. But the important thing is to have plans ready to operationalize it immediately. We can't do an immediate plan. It may be difficult. So these 3 scenarios, worsening immediate, maybe in week times, worsening the situation in a month time, or in a long time, like 2 to 3 months. So these 3, that's what I come to my mind. Maybe it is different in the health sector. So these different scenarios planning, and that's why I put special attention to whom should it be given to, who are the people at risk in these different times, and how your risk communication will be with them, and how these 5 key different things. I'm sure you are still talking more about the standard number 3, essential medicines and medical devices. So you may need to focus on that as aspects more, because that's very clear. The current crisis will have more implication on that, and also health financing with the current situation. I don't know how the financing and mobilizing your workforce, and there will be mobility restrictions because of the fuel shortage, and so I would suggest go for a scenario planning based on that, and alternatives. Think about some innovative alternatives, like Dr. Sukunan mentioned, limiting this usage here, and moving towards some other alternatives like Ayurvedic for limited usage. So it should be an alternative approach, because we can't think alternative after the crisis happened. After the crisis becomes an emergency, it's too late. So that's why scenario planning is very important. You can have a small workshop with your team, half day or 2 to 3 hours. What kind of different scenarios? Take stock of what medicines are there, and also predict the future trend or next 3 months. Which group needs these critical stocks? First priority is to save lives. Second priority is to reduce the morbidity, the increase in frequency of diseases. So you can have a quick plan on that. Prioritize is information is very key. Take all the information into the system, and then prioritize the planning. That's what I can. You may have more ideas.
Yeah, actually, thank you very much. Really, eye opener for your consideration to have a workshop with our stakeholders. But the health scenario, because as you said, this is we cannot predict how long it will be there, and also we cannot segregate people from getting medication, because whenever a patient comes to a hospital complaining some illness, we cannot say no, you are not in the priority list. So that is also it's going to be a big issue. And this stocks is going to be depleting, when if this crisis takes for a long time. That is the real worry what I have. How are we going to prioritize the, because as Dr. Sukunan said, we can think about to go for limiting the laboratory tests and all other alternative mechanisms to do the manual testing and taking Ayurvedic into the scene. But how long we can manage the situation, because already we are running out of reagents. Why there are stocks from the suppliers? They complain till we pay them, they are not ready to give the reagent to us. The other reason they said they are also have a limitation to import items because of the dollar problem. So this is multifaceted issues. But anyhow, health is that we don't have any health crisis at the moment. That means there is no rising disease like corona or a dengue or any kind of another issue. But this is a normal trend of health problem. But managing for a long time is going to be the problem. That is what I think about. How are we going to manage? Because we cannot limit our service to a certain area or a group of people. Whenever they come, we have to treat. The other issue is going to be the non-communicable disease patients. They are on medication for a long time. So if we cannot reduce 3 medication for one, because if there is a diabetic and cholesterol and all these other hypertension and heart patients, we cannot stop any medication. So this also, as we said, we have to monitor it, the trend. And what I suppose the use of this prescribe of medicines, each and every doctors has to be sensitized of the current issue. And also the other part of it, we cannot keep the medicine for a long time also. It has its own expiry dates. So I have started to analyzing the expiry items in my region, and I took the stock the valuation. It's shocking actually. So I discussed with some other PDs from other provinces. They said it's a very huge shocking. One of the North Central province of PD told me they have a expired item costing 100 million. So that this is a good time to explore our weakness also, our sectoral weakness, which is we are not bothering about wasting the resources. The expiry items is piling up. All the time we have a big stock without any worries. We ourselves, I cannot point out some sectors, but ourselves, the whole health sector is responsible to let those medicines to go spoil. So those are also is a serious issue. It's even the disaster, but it is an opportunity also for us to learn how we are managing the system, so we can utilize the opportunity as a learning opportunity. But this whole scenario is a crisis to the bad to worse situation. Is, as you correctly said, is the time. So that is what we are unable to plan also. That is my main worry. How we are going to manage if it drag for a long time. If that crisis or bankruptcy declared by June or May, what you said, then everything will be disaster. So we will try our best to hold the situation within the control. Thank you.
Just to share one thing, I just show a video of Lebanon crisis and how the health is managed. It's a long video. I just looked at on the health part as well. I mean, in detail, what they have done, because they have gone to the real crisis situation, and they have mobilized 1 or 2 NGOs got together, and then because of this dollar crisis, they can't import, and you can't get the medicine stock, medicines, really needed medicine, the critical ones. So what they have done, they have raised a campaign in foreign country to get the finance to get the money into an emergency funding pool. And I think that NGOs got that money raised and kept it. And when the crisis worsened, and when you request, they buy in that country and then they just send it. So you don't need to pay from here. So that's how some NGOs managed it. I saw that maybe if that happens, if this crisis worsens and there is no dollar to buy medicine, import medicine, you need to activate that kind of mechanisms, and you can get the support of the voluntary organizations to pool the money, keep it in a foreign country somewhere. And then when you have an emergency request for medicines, they will buy from there and import it. I mean, I just saw it. I just thought of sharing it. It could be an alternative option.
That's a really good suggestion, but I don't think that in our level we cannot mobilize it. It has to be mobilized on the ministerial level. Our Director General or Secretary has to be informed about this kind of an idea.
Yeah.
Anyhow, if opportunity permits us, we will discuss with them. But anyhow, that is how it's going to be managed. That is the normal procedure. Yeah.
So actually, Lebanon was one of the area that countries are need to look after, look into that matter and how they manage in the case. Now at the moment, yes, we are facing, will be going to face malnutrition, and also we need some lifestyle modification. So if the things break, so people need to the way the life and life modification. And also, unfortunately, we are experiencing some telecommunication problem also. So if that things happens, actually it will be a very low. It will be a big blow for the health sector, for communication things may occur. So as we know, some things are beyond our limit. We should come from the top. So anyhow, but we want to try our best to implement some acceptable plans. So we are trying our best. So yes, your opinion, Dr. Saja.
Anyone else?
Yeah, I'm done. Sorry. Yeah, you can. If there is any other comments, others can talk.
These other participants, your views on this webinar, and how do you feel? Please. The timely importance of this webinar. Okay. Anyhow, as we are getting delayed, as we started delay, so I'm here. I want to thank all the participants, and also first of all, I want to thank our guest speaker, Dr. Aslam Saja, and he's expecting our kind invitation, and also we are looking forward to work with you in future. And also I want to thank our RDHS, Dr. Rifas, and also I want to thank our former RDHS, the Mount Batticaloa RDHS, Dr. Sukunan sir, for their participation, and also other doctors and the delegates to the valuable participation. And also in our office, we had our MO planning, Dr. Mahir, and also Dr. Fazal, regional epidemiologist. As we are thinking, we are facing a big disaster, so we are in a worry. That's why this kind of collaborative things emerged. So, and again, thanks a lot for all the participants and all the guest speakers and all the main admin and all of you. Thanks a lot. We'll meet in another webinar in near soon. God bless you all. Thank you.